for me, it's not surprising. It's
You're
worrying.
not surprised by the figures at all?
It's
And even I suppose those younger people taking drugs?
unfortunately, these trends are things that we're seeing locally and globally. It's shocking. It needs to be addressed, but unfortunately, due to everything else, it's not a huge shock. Unfortunately, um, but that's not to say we shouldn't. We definitely shouldn't ignore it. We need to talk about this. It needs to be front and center. I think the Public Health Agency have a role to play here as well. I mean, I think it's important for parents to know that there's support out there. I think it's important for children to know that there's support out there. And it's really important that we talk to our young people about drugs and alcohol. Um, we have really vulnerable children out there, but we also have um, issues with access. You know, it's really easy to access drugs. We need to call out criminal gangs. We need to call out paramilitaries. We need to call out grooming and coercion of children. And I think that's what we need to get behind. I'm not a fan of suspension or exclusion from school. I'm concerned that the policies that DE and EA have are 10 years out of date. So the current policy that schools are working to was published, I think, in 2015. And a lot has changed since then. You know, we've had a global pandemic and all the other things that I've just talked about, you know, rising mental ill health, rising child poverty. So it's a pretty bleak picture. And that's why I suppose in our work and the work of other people who work with children and young people, it's so important to provide support to vulnerable families and vulnerable children at the earliest possible stages.
And you can see, I suppose, those kids that have ended up, I suppose, in those situations. But what sort of impact does it have on a child if they're taking drugs first of all, but then off the back of that, they're then taken out of school? So what sort of impact, what sort of situation could that child find themselves in if that's what's happening to them?
I suppose you're in a situation of like a revolving door or a spiral, you know, and this is why we talk a lot about early intervention and support. The cost of not intervening early or at the right stages costs the child massively in terms of their development, emotionally, physically, educationally, all of those things, but it also costs the state massively because, um, you know, late intervention means bigger bills further down the road in terms of justice, in terms of healthcare. But for that individual child, the effects of poverty and exclusion and addiction and lack of support can be devastating.